present situation now. On the one side, we see a lot of hospitals coming up, modern hospitals, everywhere. We have very few hospitals in Calicut. We have plenty of them now. And number of rooms, for instance, you have 800 rooms.
Not 800 rooms, 800 beds totally.
Okay, 800 beds, right. No, it's phenomenal growth. On the other side, we find that despite all this, there is crowd everywhere. Now, people are getting sick very frequently now, and that also at much earlier age now. Maybe in the 30s, 40s, they get chronically ill. Now, what is happening to the health of the people in the state? Maybe we are consuming a lot of drugs, a lot of medicines, all those things. No, maybe next 10 years, what is going to happen to the health of the people in the state? The hospitals coming up is quite alarming. No, it shows people are not healthy.
See, there are two things. It's a very good question. Two important things are, one is the the premature aging, you can say, due to the lifestyle diseases. See, you acquire diabetes when I started my practice. It was the diabetes was there, and maybe after 40. Even we don't even check the diabetes below 40 years. Now, if you don't check diabetes in a boy of 15 years, if it is little more, little obese, then you were very likely to miss that. So we see very, very young diabetic patients with high BP, high cholesterol, obesity, all the risk factors you mentioned, everything will be there in that young fellow. That is due to these are all lifestyle diseases which we come across daily, and it is been going up like anything. And the reason is, of course, many of you, you are all read about the health magazines and all things, everywhere it is there. This is all due to our own eating habit, or the fast foods, inactivity. The two-wheelers are the biggest this thing. The car, at least you can park, you cannot park everywhere in front of any shop. At least you walk at least 50 yards. The two-wheeler you can park right in front of the door of the shop, and you can buy from there. So they don't even walk. So absolutely lack of exercise and eating more calorie foods, and the smoking habit, of course, it has come down a lot now. It is not much as we used to have it in about 10 years back. And to some extent the alcoholism. These are all leading to early disease occurring, and that's the premature aging. The other one is the longevity has increased due to the available lot of treatment facilities, early detection of many diseases and such things. The longevity is every year. It's now, earlier it was 55 or 60, now it is about reaching up to 75, 80. So our population, the most of the patients are in the second half of the life, above 60s. So these are the two main reasons that the number of patients are increasing, and of course the awareness about the illness also is there. Then another factor is the seasonal diseases, like all these contagious, the communicable diseases which we come across, all these leptospirosis, that is the elipani, the rat fever you say, it's not the rat fever, it is called leptospirosis. Then the dengue fever, all such fevers of seasonal origin. And this year a lot of jaundice is also there. While they are getting discharged, measured to the patient, it has to be tailor-made. It cannot be, we cannot just say, some message to the patient regarding their health or. Yeah, yes. No, not as an entrepreneur, as a businessman, as a doctor. As a doctor, definitely there are a lot of, it depends on the case to case. No, we cannot. We cannot print this thing and give it to them, because it has to be tailor-made depending on the patient's illness. Some people might require very heavy exercise, good exercise, dietary restrictions and other things. Some people will have to restrict the exercise. Suppose he is you are a good physiotherapist, you know that if he is having a disc problem, should not be asking him to have a bending exercise or anything. So we will have to restrict him from exercise. Others should be encouraged to do exercise. It is like that. So all, of course, eating habits is it's a common for so many for everyone, you can say. Even from a very child, very infant age itself, now you should control all this. If possible, try to control the cholesterol and other things. People will think that now the mother will say that hey, he's a young boy. The grandmother will say it's a young chap now. Why let him eat now? Well, no, that is gone. And controlling your BP, blood pressure, controlling the salt, regular exercise. Salt was never given much importance earlier. Now actually the salt is very dangerous thing if you take it in excess. Like the cholesterol. Cholesterol, everybody is. See, another thing I have seen in our people here, no? People are very ready to, especially in Malabar, I tell you, people are very ready, very willing to spend any money for checkups. They don't mind. They get a very good file and go back home, probably frame it there and put it on the wall. They don't even, they are not bothered. Today I saw a patient. In January he's only 34. He is working abroad. In January his cholesterol is very high. He came with his wife. His father died at the age of 55 years. He had high cholesterol, high diabetes. He died of MI, heart attack. I asked him again in his he lost one of his siblings in a very young age, I don't know, but some other disease. His elder brother is also having some disease which he doesn't know. He is diagnosing diabetes, at least that he knows. So far he is not diabetic. I said, you are likely to develop diabetes within few years. He is already overweight. And today also his his cholesterol is very high. Then I told him the importance. I said, you at least take 500 tablets to Gulf and you not to buy from there because it's very expensive there. Keep taking it at least. So that's what so they do checkup, but they don't treat. From January onwards, after knowing that he is having high cholesterol, he is not bothered. So people are ready to do the checkups, but no follow-up, no further action on that. That's very pathetic.
Last one. Okay. It is said that the majority of diseases are because of lifestyle and environmental problems.
Yeah.
And it's also said that prevention is better than cure. Then why can't BMH take up some health awareness program?
We have been doing so many health awareness programs.
Will you please explain that?
See, we have done many detection camps. Sindhu knows the breast cancer detection camp we have conducted, and many diabetes detection camp. This November 14th is the World Diabetes Day. So that 1 week we are going to have a lot of diabetes awareness camps and other things. Diabetes detection, free detection of diabetes. You can come over there and you can have a check. So many things are there. Heart disease detection camp is there. Other cancer detection camp we have conducted. And we have the scrolls and other display there and on the telephone, over the TV. Now the new setup, now there is no problem with the space and other things. The ambience is also good in our new block. If you have not come, please come. Every day there will be some seminar or some small session. That's what we are planning. We have already started. Half an hour or 1 hour session on certain topics. That will be given in advance. The notice will be there. So that anybody who is interested can come in and see those things. Then immunization camp, definitely it's a disease prevention.
Thank you, doctor.
Thank you all. Thank you for the patient hearing, and thank you for giving me the opportunity again once again. Thank you.